In this section of the course, we're going to talk about someone that's collapsed in the workplace. It could be as simple as someone getting up off the chair and fainting, or it could be at worst someone that's unconscious and not breathing. It's vitally important when we respond to someone in the workplace, or anywhere in fact, that we check for our own safety and look for any dangers. So the first thing I'd need to do is assess for dangers. If it's safe to go there, then we go and respond to the individual. After that, we do a primary survey and check airway, breathing, and if we need to do circulation or compression, we'll discuss that a little bit later on in this presentation. I can see the area is safe. I might just move this chair out of the road. There's no dangers here, nothing that's going to cause any major problem to me. So now I need to get a response from Wendy. Wendy, can you hear me? Open your eyes. Use several techniques. Wendy, squeeze my hand. I can see she's not responding to my command, so she's unconscious. Sally, can you please get an ambulance? Wendy's collapsed.
Yeah, no worries.
Okay, the next thing I need to do is check her airway. Laying on her back like this, her airway is at risk. Her tongue could fall over her airway and occlude that. Let's have a look in her mouth and make sure there's nothing in there like vomitus or a bunch of saliva. Look, I'm happy her airway's clear. I can see in her mouth there's no obstruction in there. But what I will do is tilt her head back slightly like this, which actually brings the tongue from the back of the throat and will help her breathe as well. Now I need to check for breathing. Now what I'm doing is placing my hand on her chest. I can feel her chest going up and down, and I can also hear some breathing. Now this is called the look, listen and feel method. Okay, I'm quite convinced at the moment that she's breathing all right, the ambulance is on its way, but I'm not going to leave her in this position. The reason being, she might have a build-up of saliva in the back of her airway, or she might vomit, and therefore it'll occlude her airway and maybe stop her breathing. So we're going to put her on a position called the stable side position, or the coma position, which is getting her on her side. The way we do this is like this. We point this arm out the direction we want to turn Wendy to. Bring this arm up and tuck it in under her neck to give her neck some support as we roll her over. She doesn't appear to have any major injury. We'll very quickly do a survey in a minute to make sure she has no other injuries from the fall. I'm going to lift her knee up as high as I can and get in nice and close and tuck it in there, and then gently, by trying to support her neck, roll her over on her side. Bring this leg up like so to stop she doesn't fall any further, and tilt her head back slightly to keep her airway open. Now while she's in this position, we're still waiting for the ambulance. It's really important that we stay with Wendy and keep checking her breathing. Now I'll do a very quick survey from head to toe to see if there's any other injuries. Now I'm just having a feel around her head and neck, and now her back. Now it's important to start from the head end first. I can't feel deformity or anything odd there at all. Checking down her arms, nothing. Now of course, in a real life scenario you'd have your gloves on, of course, and check them for any blood or bleeding. Check her chest, feel the rib cage feels okay. Check her abdomen. It's really important checking abdomens. They should be soft, not hard and rigid. If they're hard and rigid, there's a potential that it could be internal bleeding. Just having a quick feel of her pelvis and making sure that's all solid, and just down through her legs. No, I can't see any other injuries. I don't know what's caused her to collapse. I'll have a quick look around and see if there's any bracelets or necklaces on there. No, it doesn't seem to be any medical alert tags either. Keep her in this position, keep an eye on her breathing, keep an eye on her airway. The reason she's on her side, like I said before, is that if she does vomit, vomit will come out onto the carpet rather than occlude her airway. Stay here till the ambulance arrives.